A 45-year-old man, known to inject drugs and currently living in homeless hostels, presents to the emergency department complaining of malaise, fever, rigors and arthralgia. On auscultation, he has a new pansystolic murmur heard loudest over the left sternal edge. What is the diagnosis? Options are A. Acute pericarditis, B. Infective endocarditis, C. Tuberculosis, D. Dilated cardiomyopathy, E. Myocarditis. Pause the video and answer. Answer is B. Infective endocarditis. In subacute infective endocarditis, patients present with fever and chills, non-specific constitutional symptoms, night sweats, malaise, fatigue, anorexia, weight loss, myalgias, or palpitations. Physical examination is often non-specific, but subacute presentations are more likely to exhibit classic examination findings such as Janeway lesions, hemorrhagic, macular, painless plaques with a predilection for the palms and soles, ossular nodes, small, painful, nodular lesions usually found on the pads of the fingers or toes, splinter hemorrhages, commonly noted in the nails of the upper and lower extremities, or cutaneous infarcts. Palatal petechiae may also be present. Fundoscopy may detect Roth spots, oval, pale, retinal lesions surrounded by hemorrhage. Subacute eye must always be in the differential diagnosis of a patient with progressive fever and constitutional symptoms. A 73-year-old woman is brought to the emergency department by her family. She complains of palpitations that started 2 hours ago. An ECG shows atrial flutter. Which of the following is not an adverse feature that would indicate treatment with synchronized cardioversion is required? Options are A. Shock, B. Syncope, C. Heart failure, D. Myocardial ischemia, E. Focal neurological deficit. Pause the video and answer. The answer is E. Focal neurological deficit. The adverse features are shock, syncope, heart failure, myocardial ischemia, extremes of heart rate. A 68-year-old woman presents to the emergency department following a collapse episode at home. Your consultant performs a focused bedside echocardiogram. She tells you the patient has aortic regurgitation. Which of the following is not a typical feature of aortic regurgitation? Options are A. Collapsing pulse, B. Late diastolic murmur, C. Wide pulse pressure, D. Visible distension and collapse of carotid artery, E. Displaced hyperdynamic apex beat. Pause the video and answer. The answer is B. Late diastolic murmur. Clinical features of aortic regurgitation. Symptoms: palpitations, chest pain, fatigue, heart failure, angina. Pulse: rapid rise and quick collapse, water hammer pulse, double impulse, wide pulse pressure, Corrigan's sign, visible carotid pulsation, Probst's sign, pistol shot sound heard over femoral artery, Quincke's pulse, capillary pulsation visible on shining a light through fingertips. Cardiac impulse, hyperdynamic, may be visible. Auscultation, soft blowing early diastolic murmur left sternal edge, best heard with the patient sitting forward in fully held expiration. Duration of the murmur in diastole correlates with severity of AR, Austin Flint murmur. Apical mid-diastolic murmur may be seen in severe AR, produced by the partial closure of the mitral valve by the regurgitant jet and rapid rising LV diastolic pressure.